my gosh, what's to get the lighting for this? Okay. Call me paranoid if you want, but I don't think it's like... Okay, I think a lot of people have access to these online articles, right? And the problem is not everybody's fluent in English, and everybody has the same degree of skill in linguistics as other people. So kind of like it's hard for some people to understand what the article's actually saying versus what's actually written. Okay, so I'm going through this again. It was like, cause I've seen people like, I'm not talking about news articles, like those are an easy read. It's not hard to like comprehend or understand the concepts that are being talked about in the newspapers, and typically it's something that everybody's aware of, or like, oh, it's something that commonly happens to a lot of people. So they're like, oh, our head editor in chief for the opinion section of the article has decided to try out the world's highest rated restaurant in a different country, and here's his hot take. Right? That's kind of like, again, easy read. There's really nothing, there's no actual like deeper meaning behind him talking about what his personal experience was and what the food is being served. So that's kind of what's written there, right? Like you're reading what is really like literally there word for word. That's a newspaper article. Whereas with some other articles, like that's not really what they're saying. But the way that it's been written is to kind of negate or kind of maybe, cover up for the fact that it might be probably socially unacceptable, the topic of conversation, or whatever it is that they're writing about, or like maybe it's just like something that they personally don't want to do or talk about, but they should be talking about that kind of stuff. Ugh. I feel so sick, and I'm like worrying that I'm gonna gain weight or something. Anyway, my point is, I'm reading through these like symptom articles for a lot of disorders, such as if anybody's read through the whole flu, cold, cancer, carcinoma or something, or like what is it, like when the fluid builds up in your brain, or like when you have meningitis, stuff like that. Those symptoms aren't like, it's so like vague that it's hard to understand what it is that they're actually looking for, right? And you can present these symptoms without actually being diagnosed with that actual illness. But with this, like Johns Hopkins Medicine has a article that's like any other article, and it says trouble falling or staying asleep, trembling, twitching, tense muscles, headaches, irritability, sweating, hot flashes, lightheadedness, trouble breathing, nausea, urinating often, lump in the throat, fatigue, poor concentration, being easily stirred, unable to relax. Okay, these are the symptoms of jet lag, pregnancy, flu, cold, minor respiratory illnesses. It could be actual like musculoskeletal problems. It could be arthritis. It could be any of those things. Right? There's not much for you to go on. Like, if you actually think you have general anxiety disorder, and then you read this article and they're like, see, I told you, that's not, that's the kind of like, you're cherry picking data, as in like you're actively looking for things to confirm your own biased beliefs, which is inaccurate in assessing actual problematic patients, right? Again, key points, it says has to last longer than 6 months. Excessive worry about everyday issues and situations. Now, you may think that it might be excessive for you because you believe you should be excessive for you. Well, maybe you have a different idea of what excessive should be, in addition to feeling worried, you may feel restless, fatigue, trouble concentrating, irritability, increased muscle tension, trouble sleeping. Again, they've already covered this in the previous key points. The best treatment involves a combination of both medicines and cognitive behavioral therapy. Symptoms tend to be chronic, but gets less severe as a person gets older. Again, this kind of gives the implication that you don't have to seek treatment for this. What they mean is actually it's consistent, like longer than 6 months, which means it's chronic, and it gets less severe as a person gets older. It could be like older as in you're 1 month older now, or you're 1 year older now, because they went through treatment. I know it's kind of, it goes without saying basically. um okay, so if anybody reads this, they're gonna be like, oh, do I have JD, blah 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 blah, which is something my another prof, like one prof of mine actually had mentioned. He's like, you don't go by that kind of stuff. Like, if you actually are worried, go see a doctor like a normal person. But like I said, how do you, this is, again, these types of symptoms are something that people feel quite frequently, and it doesn't have to be just internally. It could be like external factors influencing this, right? Like maybe you didn't eat properly for the last week, or maybe you have been trouble sleeping because you just got a new job, or maybe you just had a baby, or maybe your relatives have a baby and now you're worried. Like that kind of stuff. Like, that's not, this kind of symptoms arise outside of those things happening. So everything was same as before, but now you have all these symptoms as if something is actually bothering you. Like, it feels like you're getting constantly harassed, or someone's literally threatening your life and your safety every day. Every time, it just feels like that. It's like an oncoming sense of dread. You feel like someone's gonna kill you, because, I mean, the only reason you should feel like that is if somebody has told you, I'm literally gonna kill you, right? Either through body language, through online communications, or like tone of voice or speech or whatever, that kind of stuff. So that's right there. That's what that is. So you have these symptoms even though there's no reason for you to feel this way. So that's generalized anxiety disorder. Again, the thing is, if you feel these symptoms to the point where it's interfering with your everyday activities, regardless of whether or not you have GAD, right? Let's say you don't have GAD, but you have the symptoms of GAD. If you go see a psychiatrist, they will prescribe you medication for it, because these symptoms are problematic and is currently interfering with your cognitive and behavioral processes in your brain, regardless of whatever it is happening to you, right? So it's like, I have anxiety, I'm always excessively worried, to the point where I feel like I can't do anything without like always being overly concerned about myself and others, right? Then they'll give you some medications to prevent you from responding that way, regardless of what situation you're in, because that kind of responses is interfering with your current life situation. So it's just, you could fit the criteria for JD without actually being diagnosed for it, but the point is that you're experiencing these symptoms. The doctor can assess you and actually verify that you experience these symptoms and treat you for the symptoms, because that's what that's for, even if you don't have the diagnosis for it. This is the key point here. I don't know, maybe you are not understanding what's going on in your environment. That's actually what I notice consistently. I mean, this kind of happens with a lot of immigrants, where they're in a country where that's not their first language, right? So it's hard to like, okay, when like, let's say in a country, a person's first language is a certain, like, a person's first language in UK is British. I mean, English, not British. It's English, right? But like, people who can't speak English properly are typically the lower intelligent people, which means they're from the lower social class. Typically, I'm gonna simplify this. It's typically they're on the lower social class, whereas people who are regular, normal functioning, or of the higher social class can speak fluently due to past wealth contributing to their acquisition of knowledge, right? Whereas if you're an immigrant, you have the same linguistic skill set as somebody from a lower social class, yet you are not exactly from that social class, because you have other skills and attributes that aren't of the people from the lower social class. That's kind of where it gets kind of to be a little messy, I guess, because people are going to assume that you are stupid or can't understand, or like there's something wrong with you if you can't speak the language in that country fluently, disregarding the fact that you're an immigrant. So they're expecting you to be as fluent as them in that country, regardless of blah 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 blah. So that's kind of, I mean, that actually causes a lot of miscommunication. It causes people to respond negatively to people. It makes people have assumptions about people, despite the fact that they're not, how do you say this? They weren't actually, it causes them to have negative assumptions about people based on their, like, a very superficial level of, like, you don't speak as fluently as me currently, and the only people I've met so far who can't speak English were people who are stupid. This is how I was socialized. So because you can't speak as well as me, I'm gonna assume that you're stupid. That kind of stuff. That's where the thing. No, I don't fucking know. Look, my point is. Oh my god. No! There's a lint on my pizza. Okay. Oh my god. This is kind of where people get kind of. Doctors don't go by that. Look, honestly, the doctor's not gonna say that anything outside of your symptoms because it's inappropriate. Right? Like, let's say they see that you have problems and they know about your social life and they're trying to give you advice on how to navigate your social situations and whatever you should do to combat. I mean, not combat, but like whether, like your friend's been giving you problems and stressing you out, so he's telling you what to say to your friend to, kind of reduce the stress and the tension between your relationship. That's called having a relationship with somebody, right? If that's the case, it's really inappropriate in a professional context. So that's why they only treat you for the symptoms that you're currently experiencing.
We strongly recommend customers wear cloth masks or face coverings when traveling on the CDC.
So I don't understand why,
For more information.
well, this is a hard concept for a lot of people to understand. Yeah.
Station will be closed from June 9th to June 22nd to accelerate easier access project construction. Trains will bypass Chester in both directions. Please use Broadview or Pace during the construction. Both alternate stations are accessible and within walking distance.
Look, I think people it's easy to access these online articles regarding all these things and then try to diagnose or self-diagnose yourself or whatever. Look, if you're really that concerned, please, about yourself, go see a psychiatrist. And if anything, they might even consider you a hypochondriac, which is a medical term. It's an actual medical condition for people who chronically experience symptoms that are considered let's say, oh, doctor, I think I have the flu, I'm experiencing symptoms, and they can see that you're experiencing that symptoms, but you don't actually have the flu. That's called hypochondriasis. Yeah, that's a medical condition. Like, you keep thinking you're sick and you're experiencing and you're about to die, but you're not, you're fine. It's fine. But your symptoms that you're experiencing may or may not be real. In most of the cases it is. Like, they actually do have a runny nose and they're actually experiencing hives and stuff, and they're like, doctor, I think I have Lyme disease. And they're like, I think you're fine. Let's give it a couple of days to see how things are. That's what that is. Lyme disease is a commonly infected disease from ticks, and ticks are very abundant in the woodsy area in Americas. Okay, and they live in the woodsy areas, and they come out during probably late summer to early fall. So during that time, and then there's black flies, but that's only during near swampy, marshy areas. And then there are mosquitoes. Mosquitoes are everywhere. Um, there are also fleas. Yeah, they bite humans too. Ant bites. What else? Spider bites. That kind of stuff. Yeah. But yeah. Please, before you diagnose yourself, okay? Go see a doctor if you're really concerned. And if anything, the worst you'll get if everything's fine with you and you're still experiencing symptoms, they're probably going to call you a hypochondriac. Yeah, that's a patient who they think that they have all these disorders, but they actually don't. They're fine. Well, yeah. Yeah, okay, so when is it considered an actual abnormal thing, regardless of even if you have it or not? I mean, if it gets to a point where it's interfering with your life, as in you can't even go to work anymore, and you stop maintaining your relationships, and you stop, looking after yourself, that kind of stuff, when it gets to that point, it's already kind of gone too far. Before that is when you should be starting to seek treatment or asking the doctors about potential risks associated with said things. Then, oh doctor, I think I might be at risk for whatever. I think I might be developing some symptoms that I'm concerned about. And then he or she will tell you blah 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 blah. Here's some medication if you want. Also, this is I guess this is with all doctors that I've noticed. Nobody really likes to say this, but they're very it seems like they're picky, right? Doctors are like, I don't like this person, so I don't want to work with them. Get out of my life. Right? Apparently it gets really bad when you're studying in med school and you just you do some really stupid thing and everyone in med school hates you now. They don't want you to be a doctor because they're gonna have to work with you. Or even work in the health field ever for the rest of eternity. Or be associated with you in any way. Look, the only reason they're like that is because it's a very stressful job. I mean, you're seeing sick patients all the time. There's so much legal liabilities associated with the work. There's a lot of finances to maintain. There's a lot of case studies to go through. Plus, you have to continue to progress and work in conjunction with other researchers to progress medicine as a field of study. And it's a lot of work. It's a lot of stress. And the last thing they want is to have to put more stress on themselves by working with somebody they don't like. That's what. So, please, try not to piss off your doctor. I mean, if they just don't like you as a person, but you're a client or you're a patient rather, and they just they just saw you and really have nothing to do with them outside of being a patient, they're not gonna do much, honestly. But if you actually I mean, I wouldn't really recommend going to see a doctor and then you're fine, mentally, but physically you have a broken leg or something, and then you just try to rip on that guy or try to nag him or whatever. I really wouldn't recommend doing that. Just because they're people too, right? It's gotta interfere with your treatment. Because if they don't like you, then they're gonna do the least amount of work as possible, and your treatment's not gonna be. It should have only taken I don't know 6 months, but now it's taking 2 years. And it's why is it taking so long? It's because you were insulting the person the entire time, and you thought you were better than that guy. I don't know why you would think that, but that's what that was. They get stressed out. Okay, it's a stressful job. So that's why. You know what? If you lie to your doctor, but like the only reason they'll even put up with that is if you're in psychiatry. So if you're insulting the doctor, but you have a mental illness, they're not really gonna take it personally, and they're not gonna stop the treatment unless it gets excessive to the point where, regardless of your mental illness, like you may think it's because you have a mental illness, they can't tell. They can. Your own personality traits and preferences and your core beliefs and behaviors. There's a whole field of psychology for that. It's called personality psychology. um, yeah, they read psychology journals too. I want to point that out right now. Some of them read sociology journals, some of them read criminology journals, but mostly it's psychology and medical journals that they read and study case studies on it. Most of their patients are involved in that kind of area. But yeah, please don't. I don't know why you do that. Why would you? Why would you? Why would you go see a doctor and then just like yell at the doctor for being an incompetent asshole when he's just trying to put salve on your body? Just, I don't think they're not nurses, okay? I mean, you could do that to a nurse, it's not gonna matter. But like, I just don't do that to your doctor. He's the one prescribing you the medication and looking after your assessment, and he's the one that can read the charts. I know the nurses go through it, but they don't actually know how to read the charts or understand the medical documentation or understand the legal implications of it. Hence, they are nurses. What? I don't want. Please. Maybe I'll just start a new social movement. It's called Be Nice to Your Doctor's movement, otherwise he's gonna be an asshole to you. But you don't notice it because he'd be in his medical treatment. You'd be like, ugh.